I'm Ashton Addison from EventChain for Investment Pitch Media and the Crypto Coin Show. And today on Blockchain Interviews, we have Pradeep Goel, the CEO of Solve.Care. Pradeep, welcome back to the show, and thanks for taking the time to be here today.
Ashton, it's my pleasure, and I'm looking forward to our session today. Thank you for having me.
You're welcome, and likewise. I would love to start with an overview, high level of Solve.Care. For those who didn't see our last interview, we can talk about some of the solutions and how you're disrupting the health tech industry, and then we can dive into the details.
Sure. So Solve.Care is a healthcare platform which was built with the idea that digital health networks take a very long time, effort, and risk in being designed, configured, and launched. And I personally oversaw many digital health networks launched in the US around insurance benefits, around employee benefits, around public health benefits. And they all took far too long, were too expensive, and ultimately failed to get the adoption we wanted. And they failed to deliver the results we wanted. And with the advent of blockchain, with the advent of the ability to decentralize data, identity, transactions, and payments, I realized an opportunity exists to really make an equivalent of Salesforce.com platform on blockchain for healthcare, which allows different network participants to safely participate in multiple networks and do so on terms that are acceptable to consumers and patients and their families. So basically, Solve.Care is really designed to facilitate a better care coordination, better benefit coordination, better payment coordination. It uses blockchain as a coordination fabric and really bridges the gap between having a pure blockchain technology and the need to have a complete functionality to build an actual consumer-friendly digital health network.
Definitely. That's a great intro, Pradeep. And yeah, you mentioned there are quite a few issues in the industry right now. Some on the provider side, in that it's really expensive and it takes a long time to set up, and there's all these moving parts, and it's tough to coordinate that, especially since the industry's been around for so long and all this new technology is coming in with innovation, and they're trying to put one piece in at a time without having to redo everything, and moving to like a global telehealth system is a big innovation for an industry that's not just ready to overhaul all their technology. And so on the patient side, it's a bit of a different experience, I'm sure, now moving to having the lockdowns, moving more into telehealth, virtual and digital for all their files and access to kind of healthcare worldwide as well and remotely. Can you talk about some of those changes and solutions that you're providing in this move to digital and then into blockchain through Solve.Care solutions?
I'll give you 3 very concrete examples to make it real for people who are looking at it from a consumer patient perspective. So the one network we have just launched on our platform is a global telehealth exchange. And the idea of this network is to allow providers and patients worldwide to connect with each other on a purely voluntary need basis. So it's an exchange that matches physicians anywhere in the world with patients anywhere in the world, but it matches them per the rules of various jurisdictions in which the patient or the doctor is based, on the needs of the patient, the availability of the doctor, the specialty of the doctor, and so on. It's a very complex matching system, very much like how you match stock buyers and stock sellers. Here we are matching doctors who are available, let's say in Ghana, for a patient in Nigeria who has a specific need that this doctor can meet, and also from a regulatory compliance and from a specialization and payment and cost. So a multifaceted matching network, which runs in a purely autonomous manner, but doctors sign up based on the type of practice they want to do, and patients sign up based on the need they have, and the system matches them. And it also facilitates real-time digital payments using Solve token. It allows the patient to immediately book an appointment. And the way the system works is the patient puts out a request on the blockchain saying, I need a pediatrician in the next 4 hours. And I need a pediatrician that is female, and my needs are next 4 hours. And I'm looking for a physician worldwide, or looking in Africa, or looking in Asia, or I'm looking for a physician in my geography where I live. And that event goes on the blockchain. And from there, every physician on the network worldwide can read and respond to that event automatically. And the physicians that respond to that event automatically will get matched with the patient, and the patient can choose. You don't need to have any kind of pre-existing relationship. You don't need to go search a provider directory and randomly pick the name of the patient, the physician that you might like. The system does the match for you based on purely empirical metrics. And every transaction between patient and physician is then recorded in an anonymous way so that there is no question about any consents or rights or privacy. All those are handled by the blockchain. So this is one way to truly democratize access to healthcare. Now, compared to every other telemedicine solution on the planet, where the telemedicine solution network is predetermined, only certain doctors who are on the network can only see certain patients who are allowed on the network. So both sides are controlled. The demand is controlled, the supply is controlled, and there is hardly any flexibility or freedom. And costs are predetermined by the network sponsor, the telehealth solution. Everything is controlled for you. We are the opposite. We are the open network. And the only reason it can be open and secure is because of our platform built on the blockchain. So this is one. A second really interesting example for digital health networks and blockchain, and we have built many networks, but I will give a few examples to illustrate. So we have built a system on which you can have a non-emergency medical transportation system, a network where we have connected with Lyft and Uber, and we can essentially allow a patient who needs to go see a doctor to automatically determine what is the cost of traveling from their home or their school or their work to the physician's office and back. And that transaction can be paid for by third parties, like your employer, like your friends and family, like even your doctor, or your government agency, like in the US Medicare or Medicaid, or in UK, the National Health Service. And that transportation is tied to a clinical appointment. So, and that cannot be misused. The pickup point and the delivery point and the return point back to home or work can be fully managed and can therefore eliminate the several problems around doing clinical transport systems: cost, availability, fraud and misuse, cancellation of appointments, no shows. All that issue goes away. The doctor, the patient, and the third party paying for this ride are on the same fabric, but identity of people can be fully secured and protected. So the benefit payer does not need to know about the identity of the beneficiary. Only they need to know that it is a beneficiary. Very complex problem that happens that requires a lot of people, a lot of middlemen today in government programs. Eliminates all that. And our estimate is that in a single state, in one state out of 50 in the United States, this program would save $50 million a year or more for the US taxpayer each year. So that's a different kind of a network. A third kind of network we have launched is around diabetes care coordination. So when you have diabetes, you got to have a primary care physician, an optometrist, an ophthalmologist, an endocrinologist. You probably need to see a cardiologist. You'll probably need to see a podiatrist for foot inspection. So diabetes care requires a lot of coordination, and everybody needs to be in sync with each other. And yet, rarely are all these people somehow connected to a single EMR. They never are. So in the diabetes care model, we allow for patients' symptoms and needs to be published on the chain without de-identified, where they cannot, patient identity is always protected. And all the subscribers to the patient's wallet have access to certain events, allowing them to do their job. So insurance company gets certain events on which they can do billing. The podiatrist gets their certain events on the basis of which they can schedule an annual foot exam. The cardiologist gets certain events on their wallet for them to know when they should ask for an updated EKG. And this coordination between patient, their family, their friends, their coworkers, their employer, who needs to give them time off to go get the exam done, all that happens in a network, care network on our platform. So these are three distinct examples. One is around teleconsultation. The other is around transportation. Third is around chronic care management. But they are just examples. We have dozens more networks being planned on our platform. One is around suicide prevention, where teenagers can report in their thoughts and their worries and their stresses in a fully anonymized manner and connect with a psychologist who can intervene based on the level of risk and threat that the child is or the teenager is feeling, thereby reducing the incidence of suicide. We are building another network around helping physicians who are dealing with trauma and stress of not being able to provide enough care, particularly in the pandemic. So essentially caring for care providers, where we connect physicians to other physicians who can coach them through difficult periods, overwhelmed through multiple shifts, not getting enough rest, feeling like they're not being able to help enough patients. Physicians are under a tremendous amount of stress from COVID and other, the mortality rate is super high. So caring for care providers is another example. In all of these, there is a theme. The theme is that the blockchain facilitates private, secure communication between patient, doctor, or other family members. It allows for coordination at the event level without exposing unnecessary information about the event generator or the event receiver. And it changes the model. So we expect over the next 6 months to see a whole host of new networks come out on the Care platform. We have 5 networks today built, and we expect dozens more to be launched over the next 12 months.
Great examples, Pradeep, and I think that they are in such timely need with the pandemic. Last time we spoke, the pandemic had already started. You had just launched the Global Telehealth Exchange. I know that you're expanding into new jurisdictions. I've seen some recent updates surrounding that. Can you talk about, since we last spoke, how is the growth, the adoption, and the feedback on the Global Telehealth Exchange going?
Yeah, so Global Telehealth Exchange was the first network I referred to earlier. I'll be very happy to talk about what we have done. So we have expanded our vision from regional to global. So that's the first thing we have gone. And what we have done now is we've launched it in 20 countries. So where physicians in 20 countries are available to patients in those 20 countries. And the next step that we are headed towards is to expand the network to about 66 countries, which we expect to do over the next few weeks. And eventually our goal is to cover all 195 countries in the world, both from a patient demand and a physician supply perspective. Wow. But if you think about what we have really done, it's very remarkable, is that we are using the blockchain to coordinate the various compliance needs of a physician based on where they are licensed to practice with a patient where they are currently located or where they're traveling to or where they're resident of, and linking them in a manner that can be validated by regulators and auditors to be compliant with the local laws. So in reality, if you take 190, if you can permit any patient or a patient in any country to be able to find a doctor across every country, you would end up with about 38,000 regulatory pairs or considerations or relationships. Then for each regulatory pair, what we call a patient-provider pair, we will end up with many considerations like insurance requirements, cryptocurrency, credit card, data storage and privacy, patient right bills like HIPAA, GDPR. So you end up with millions of combinations of legal and regulatory combinations. Nobody has ever attempted to even do this across more than one within the boundary of a single country where most telehealth solutions exist. And no matter how big your healthcare solution is, it tends to be inside a country. There's a big companies in the US that have telehealth solutions for United States. You have big companies in UK that have telehealth solutions for UK. Now, even if the same company goes to US, they stand up a new network in the US. If that company goes to Canada, they stand up a new telehealth network in Canada. If they go to Singapore, they set up a new network in Singapore. Nothing connects these networks. There is no real global model of me being able to find a Swedish pediatrician for my kid just because I feel that I want to have him be treated on a Swedish care protocol. That model doesn't exist. You can pick up the phone and call your grandmother in Sweden and get her advice, but you cannot pick up the phone and call a pediatrician in Sweden and get their advice. Why is that? How come I can call my untrained, unofficial physician called grandma anywhere, get her advice and take that into account, but I can't seek an advice from a trained pediatrician in Germany without going to Germany or without having some personal connection? We need to break these unnecessary boundaries, but we need to do that in a way that protects patients' rights, protects providers' rights, and allows this relationship to happen inside a regulatory permitted relationship. So this global telehealth exchange uses blockchain to not only allow these connections, but also uses it as a way to protect both sides. Should there be a question about who saw whom and under what license agreement or consent model did they see each other, that protection is provided by the platform and by the blockchain. So it's a necessary level of auditability as well. So at this point in time, we are moving aggressively to launch about 1/3 of the planet is going to be covered in the next release. And then eventually we expect over the next 12 months to really cover the entire globe, where a patient in Nigeria, when they search for a physician, can find physicians not just in Nigeria, but essentially in any part of the planet. And then it's up to them to choose the physician and the type of consult they want. And they can also choose based on cost, availability, specialization, where the physician is registered, where the physician went to school, on and on and on. But the exchange does all the matching. So a physician doesn't have to become an expert. The idea is that a working class single parent who doesn't have time to go take their kids to a pediatrician during working hours needs to be able to find a pediatrician who's available at 10 p.m. at night when she's home and the only time she can see one. And we need to be able to find the pediatrician available in that next 30 minutes. And the choice is their immediate geography or halfway across the planet. And that exchange should give them all those options. So GTHE, in my mind, is, as we refer to Global Telehealth Exchange, is a foundational restoration of patients' rights as a parent, as an adult, as a child of a parent who needs care. We need to restore choice. We need to restore access. And we need to make things affordable. And we should be able to choose the equivalent of our grandmother anywhere on the planet and say, but you are not my grandma, but you are equivalent to me because you are a trained physician with certification in Canada. And I want to speak to you and get your opinion. So that's what GTHE is.
Definitely. Great examples, Pradeep. And as you continue to grow out into these other jurisdictions and make it truly global in the next 12 months, which is very impressive, what are some of the parties that you need to help achieve these goals? Are you looking for more strategic partnerships, more physicians and healthcare providers, or just more patients or more regulatory bodies to accept and get into these countries?
So first and foremost, our focus is on enabling the physician to practice medicine the way they want, when they want, with whom they want, and the price point they want to practice. So our GTHE today is a patient-paid direct payment from patient to provider model. Of course, the patient can then seek reimbursement from their insurance company, as an out-of-network provider. That's fine. But really, it's a direct access, direct payment, instant appointment, instant telemedicine framework. Having said that, we have physicians now signed up for GTHE from over 40 countries. So doctors from from 40 different countries have said, I love it. I want to be practicing medicine online. So our goal is, of course, to cover every country on the planet, or at least every country where we are legally allowed to do business. And there will be a handful of countries where, because of political or regulatory concerns, we will not go. But I think that's going to be something you can count on your hands, on your fingers. Every other country we expect to have physicians, and we are reaching out to physicians, and we're getting tremendous response. Physicians love the restoration of dignity and rights and choice for them as well. Right? One of my physicians said to me, I would rather practice 4 hours in GTHE a day than to spend 40 hours in my office, because I do more and I get more satisfaction out of it. And some of those hours I can afford to do pro bono, and some of them I'll charge for, and I'll set my own rates. And this is exactly how I want to do it. And this particular physician has licenses in 3 different countries. Grew up in one, got their licenses there, moved to and did residency in another country and have their license there, and then eventually lives in the United States. And his point is, why can't I practice medicine in all 3 countries? I have licenses in all 3. Why can't I see patients in my home country where I'm fully licensed physician? Why can't I see patients in the country I used to live in where I'm fully licensed still, board certified? And of course, I am currently living in the US and I have license there as well. The answer is you should be able to, but practically that's very, very hard. On GTHE, he can do that. He can simply publish his practice to have 3 countries where he's authorized, and the exchange will automatically match this physician to all the patients where he's legally allowed to see, whether it's those 3 countries or 30 others. So the point here is that this is giving physicians enormous flexibility and restoration of their rights as a physician. So having said that, our objective is to work with regulators worldwide, wherever there is regulation that is unclear, to make sure they understand what we are doing. We don't wish to ever harm the patient. We don't wish to ever break the law. So we are working through these scenarios country by country, but we are growing rather quickly because we're finding a lot of appetite for what we're doing. So to answer your question, coming back to it, physicians is who we focus on. Physicians automatically have panel of patients that they activate on GTHE, which makes it very easy to grow quickly. And we always are looking to engage with the regulator wherever we can. So just in very recently, like in the last 48 hours, we have engaged with the regulator in Korea to talk about where telemedicine in Korea is largely prohibited, but we are working with them to understand in what scenarios does GTHE make more sense to launch in Korea. And there's a lot of appetite for it. Of course, the scenarios will be well defined. The regulations have to be coded into the matching algorithm, but those are relatively quick things for us to do. So similar conversations are happening in the Middle East. Similar conversations are happening in India. There is hardly any. I mean, there's any continent that is inhabited today, we are having conversations there, and plan to grow there rather quickly. So the idea is that auditability, transparency, instant payments using digital assets, fully secured record transmission between parties, absolute control over consents and data, and patient privacy is always protected and 100% in their hands. Those things really make it possible. In fact, all of those things are needed for you to build something like a global telehealth network. And we are, I think, the only company on the planet that not only is attempting something so audacious, but has actually done it. So now it's all about scaling.
Very cool. Pradeep, I love it, and it's great to see how quickly you're expanding. And if there are more people that are interested in following along with Solve.Care, learning more, whether it be physicians, regulators, patients, or other parties, what's the best way for them to learn more?
So Solve.Care website is www.solve.care. We have a very active channel on Telegram where we have thousands of people continuously engaged in conversation with us and with each other. We have our normal communication through info@solve.care, where we receive lots of inquiries from worldwide. We have a provider relations team that works with physicians to educate, engage, enroll, and certify them on GTHE. And we do that at no cost to the physician. So they can always reach out to us, and we will handle all the proper validation of their clinical credentials. We will make sure that they are who they are. And if they are a board-certified physician in their country of residence, then we'll bring them on with appropriate profile onto the platform. Certainly, patients can download the Care Wallet for free from the App Store. A new version goes out, I think, in the next 24 hours, which will be available in 20 countries, not 2. And then over the next few weeks, we'll be increasing that to 66 countries, I believe. And then it goes to the full, the next round will add more countries. So Solve.Care is very open and transparent. Our vision and mission always is that what we are doing is so worthwhile and impactful on humanity that we want to be as transparent as possible. So neither the regulator nor the physician nor the community should ever be surprised. Of course, we want to protect our intellectual property, but beyond that, we are continuously informing and educating the market. Having said that, if anybody wants to reach out to any of my team members, we are always 24/7 monitoring the Telegram channel and the emails. That's how you would connect with us.
Great. Thank you so much for taking the time today, Pradeep. All the best with Solve.Care moving forward, and let's follow up in the near future.
Thank you, Ashton. It's a pleasure as always, and thank you for having me. I really appreciate it.